Hello, today we're going to talk about gout and specifically ways to prevent gout flares using non-medication options. So just as a brief review, and we have this on other videos in terms of background of gout and treatment of gout with medication, gout is the most common cause of inflammatory arthritis. It affects about 4% of people. It becomes more common as we get older and is more common in men overall than women. Premenopausal women generally do not get gout, but that certainly increases with age in postmenopause period. The first toe is the most common place to have a gout attack, but certainly it can happen in many different joints throughout the body. Typically what happens is suddenly you have onset of a red, hot, painful, and swollen joint, and this will last typically at the beginning for about 5 to 7 days, and with or without treatment, typically will resolve on its own. Over time, left untreated, that can change, but that's what most people will experience. Now, gout is caused by excess uric acid in your body. That uric acid, when there's too much, starts to deposit in places it shouldn't, including joints. And your body's immune system tries to get rid of that uric acid in the joint. And it's the immune system's response to uric acid which causes a gout flare. So it's not the uric acid itself causing the flare, the attack, but in fact, it's the immune system's response to its presence there that causes that attack. Now, acute treatment for gout means that we treat the gout attack when it happens. And there's options there, and we talk about that on our website and other videos. And there's also chronic treatment for gout, meaning we can prevent the gout attack from happening in the first place. And we do that by lowering and controlling your body's uric acid levels. And again, there are medications that can do that. The bottom line is with medication, gout is a treatable and preventable condition for the vast majority of people. There are some natural things that we can do to lower your uric acid, and by doing that, potentially prevent attacks from happening. So what are some of those things? So diet can play an important role. So uric acid is produced in your body when the body breaks down a chemical called purines. And purines can come from food, and foods with more purine can lead to higher uric acid levels in the body. So foods with more purine in them include things like red meat, organ meats particularly are high in purines, shellfish, and high sugar drinks, so cola, soda, and juice, but juice with added sugar as well. All these things can raise your purine level, your uric acid level. So by avoiding high purine foods, that can help your uric acid levels. But it's difficult to avoid all purines in your diet. If you took anything that would give you purines in your diet away, you'd actually be left with a very poor diet that probably would be bad for your heart. And in fact, it wouldn't substantially lower your uric acid enough. It only would go down by about 10%, which in most people is not enough to then actually treat gout. So for most people, removing all purines from your diet is not reasonable. Things that have higher purine loads is something that may be worth looking at. And there are some people who certainly are aware that if they eat a certain food, that seems to trigger an attack. That's not the case for everyone, but for those that they notice that association, certainly it would be reasonable to avoid that food. The other very significant thing that we can do to impact your uric acid levels is looking at alcohol intake, particularly beer. Beer is very high in purine levels. And if you are someone who enjoys beer and has it regularly and has gout, sometimes by cutting beer altogether, that can result in normalization of uric acid levels. And by doing that, you may not have gout anymore. This can be significant for a number of people. Other alcoholic beverages can also contribute in a similar sort of way, but certainly beer is the number one. So in no way I would suggest to replace beer with other alcoholic beverages, but certainly reducing alcohol overall and beer in particular can have a significant impact. Weight can play a role. Certainly, having a heavier body weight is going to contribute to an increased risk of gout and gout attacks. So by looking at controlling body weight, that will be helpful. The other thing which may help, but again, not significantly enough, is vitamin C. Vitamin C can increase your excretion of uric acid. So uric acid going out of your body, that's through the kidneys. And so when you pee through your urine, more uric acid can go out. Now, at even higher doses of vitamin C, it's only going to decrease your uric acid load by about 10%. And that's, again, insufficient for most people. So lowering your uric acid by 10% is not going to be enough to make a big enough difference that your uric acid is low enough to prevent attacks. But what it can do is increase your risk of kidney stones by increasing your vitamin C levels. So you do have to be very careful if this is something to consider. There's some data to suggest cherries and blueberries may be helpful as well. Ultimately, these natural treatments can be helpful, but for most people, other than removal of beer, is not going to be complete on its own. Looking at medication options probably is going to be the most definitive way to lower uric acid. We have other videos to go over that when it comes to gout and gout overall. Feel free to watch them or visit us on our website at albertarheumatology.com.